Hello, and today we will be discussing heart disease by Kendal Kordis. What we're going to go over is what heart disease is, the amount of people who die from heart disease, preventative measures to be taken, treatment processes, how to get help, what you can do to get involved, and then the sources. I chose to do heart disease because my grandmother suffers from AFib. I want to learn more about what causes heart disease and what positive health behavior should be adopted to prevent it. Heart disease. The term heart disease refers to several types of heart conditions. The most common type of heart disease in the United States is coronary artery disease, CAD. CAD affects the blood flow to the heart, and decreased blood flow can cause a heart attack. Common symptoms: you can have a headache, like dizziness, lightheadedness. In your lungs, there will be like a shortness of breath, and over by your chest, you'll feel like pressure, heaviness, or discomfort or chest pain. Some things that can cause heart disease is an unhealthy diet. Small changes in your daily routine can decrease your risk of heart disease and stroke. Stress: people who have high levels of stress or prolonged stress have higher cholesterol or blood pressure. They may be more prone to narrowing of the arteries, which is a stroke risk factor. Recreational drug use: drugs such as amphetamines, marijuana, cocaine, ecstasy, heroin, opioids, LSD, and PCP can increase your risk of having a stroke and developing heart disease. When a stroke occurs, it often happens within hours of drug use. Findings. Russia is the number one country that has the most amount of deaths from heart disease. Nearly 60% of all deaths in Russia could be contributed to this. The second country that has the most heart diseases is Hungary. For every 100,000 people, roughly 1,330 people die every year. And then China is number 8 when it comes to heart disease deaths. 230 million people every year die from heart disease in China. In the United States, in 2021, 695,000 people died from a heart disease. 1 in 6 males and 1 in 7 males are current smokers. This makes them more likely to have cardiovascular disease. Sorry, guys. Prevention. Eating a healthy and balanced diet that has plenty of fresh fruit and vegetables and whole grains, and limiting the amount of salt will decrease your risk of getting heart disease. Any aerobic exercise, such as walking, swimming, dancing, makes your heart work harder and helps keep it healthy. Also, working out will reduce your stress levels. Don't smoke or consume alcohol. Smoking is a prominent risk factor for your arteries to become narrowed. Heavy drinking is a risk factor for high blood pressure, heart disease, and stroke. There are genetic predispositions for heart disease. If any of your family members have diabetes, high blood pressure, or high cholesterol, you'll be more likely to have heart disease. Treatment. Most doctors start with lifestyle changes like taking away alcohol and smoking, exercising, eating healthy, and limiting salt, and maintaining a healthy weight are some of the things that they'll start with. If that doesn't work, then doctors will resort to medications, and depending on the type of heart failure you have, there are specific medications for that. If medications and lifestyle changes do not work, then you may have to get surgery and procedures done where they will place like a device in your heart to help treat the problem. If you think you have heart disease or are at risk for heart disease because of family history, see your healthcare provider. Involvement. If you want to get involved and teach more people about heart disease, you can dress in red. National Wear Red Day. It's the easiest way to raise awareness. Getting screened: if you have any family members with high blood pressure or high cholesterol, it's a great way to catch the signs early on. And also encourage your friends and families to do the same. Learn how to do CPR. A lot of people die from heart attacks. Take action. Lead lunchtime walks to provide a little extra exercise for you and your community. Cook something up. Set a personal goal to seek out especially heart-healthy meals during the month of February. Do a digital. Spread the message of heart health across your community by sharing pictures of you dressing in red or the date for a CPR class.